know different people. Share your comments, reflections, and put some questions in there because you might have questions that come up on the way. So I understand it might be easier for you to type them in the moment rather than waiting for that Q&A. So please do use that chat box, and also sort of practicing what we preach. I'm very happy for you to be active during this session if you can, within reason. So if you fancy standing or you fancy doing a bit of sit to stand, maybe some squats or lunges just to bring a bit of energy whilst you're listening to the panels today, then I really invite you to do that. And just as sort of a pre-warning, towards the end, as I mentioned, we will be asking for your reflections, and that's because this really is your network. So we want to know how this is working for you and how we can continue to evolve it for the next time. So I'll just be asking you to reflect on how engaging you found the panel format today, because obviously usually we have presentations. So we'll just have a quick poll, and then I'll just ask you to put in the chat what you've really taken away from today. And yeah, that's just so that we know how this format has resonated with you. So for now, I think we are right on time to start with our first panel of speakers. So hopefully we will have been pinned, so you'll be seeing us on your screen. So our first panel, we're going to be discussing their thoughts on this topic of supporting people to get physically active through providing accessible places and spaces. So I'd like to let you introduce yourselves. Pete, would you like to go first?
Yeah, thanks for having me again. It's great to be back. I'm Pete. I'm the activation manager for the We're Undefeatable campaign. So we'll be talking through a little bit about how we do some inclusive marketing and some examples of that today.
Brilliant, thank you. And Nicola?
Hi everyone. Yeah, thanks for having me. I'm Nicola from Activity Alliance. I'm one of our strategic partnership advisors, and I am lucky enough to work in the Southeast region. So I get to work with you lovely people. And our role is really just to try and help as many disabled people to be as active as possible.
Brilliant, thank you. And Frankie?
Yeah, hi everyone. Nice to virtually meet everybody. Yeah, I'm Frankie. I was originally invited to take part in the webinar as I was the workforce lead for British Blind Sport. So they're the National Disability Sports Organisation for those who are blind and partially sighted. But I've just moved over across to Activity Alliance, a different programme to Nicola, as part of a Recover and Reinvent around participation, employment and volunteering for those who are disabled in the sports sector. And also I'm actually visually impaired myself. I'm a visually impaired tennis coach and player. So just going to bring a bit of lived experience as well, hopefully to the conversation.
Brilliant. Thank you so much. So to start with, we know that supporting people to get started with physical activity really starts from the very beginning. So for someone who is inactive, the marketing is going to be really important to actually get them to a space. So Pete, I know that We're Undefeatable focuses a lot on accessible marketing. So it'd be really helpful if you could tell us a little bit more about that.
Yeah, absolutely. So for those that don't know, We're Undefeatable is a campaign to support people with health conditions to be active and to move more. And everything that we've done around inclusive and accessible marketing is based on lived experiences of people with long-term health conditions and basically making sure that it relates to their needs and their preferences. So there's probably three key things to talk through on this point around the language, a little bit about the tone of voice of the campaign, and then also a little bit around the sort of imagery that we use and how We're Undefeatable does it. So I'll start with language first. So I was looking at this and looking back at all of our previous campaigns and thought that all of our campaign themes over recent years have had a real key hook around the language that we use. So you'll see that even more in these spaces now, we tend to talk more about moving more or being active rather than fitness, exercise and sport. I was in a leisure centre the other day and seeing eat, sleep, train, repeat on a poster. And I thought that does work for some people, but not for the people that we're trying to reach who are living with one or multiple health conditions and potentially inactive, and that's not language that they would connect with as well. We tend to focus on building activity into daily lives and that message around getting started on a physical activity journey. And that doesn't necessarily need to be something structured. It can be, and there's benefit to that, but also to help those who are inactive, really getting them started is the first point of call. We've used key hooks like every move enables more. So encouraging that thought of doing some sort of activity can then lead to more in a person's daily life. So one of our stroke survivors, Zoe, she and storytellers, she uses some pegs as like a rehab exercise to get strength back in her hand after a stroke. And the idea behind that is that then that allows her to put the key in her front door and open it, which might be something that seems quite small to us, but actually that's a huge part to Zoe's life, and being able to do that task is something that could be really important. We also think about celebrating every little victory. So celebrating those little things, those small achievements. And then when it comes to tone of voice, we've done a lot of research over years, which you can find on our campaign hub, which we'll link to later. But one of the big things that come through our lived experience workshop last year was around somebody who was living with arthritis and multiple conditions said, people with health conditions have a non-linear journey. And that's always stuck with me, because it's sort of that we can be adaptable and things can go up and down for people when living with a long-term health condition, and no 2 days may be the same. So again, another real key tone of voice, and encouraging that rest and recovery is just as important as being active, and taking that time to rest and to really listen to a person's body is really important for this particular audience. And something that the campaign do throughout all of our marketing and advertising is also balancing the positive and negative. So a bit of the light and the shade, I guess. So when we want to make this feel as real life as possible, and we want to share the challenges that people are facing with living with a long-term health condition, because that then makes it a little bit more relatable. But then at the same time, we also want to share that positive energy when that person is being active, and the benefits that it has on not just on their exercise or their activity levels, but more so on their wider health and well-being as well. So whether that's running around with their children or moving more, as a social aspect to their life, it's sort of shining a light on those different themes. And then really quickly, finally, just on the positive imagery, I think you shared Geraldo's image just before, Amy, on your screen. And I think having condition cues is really important. So we want to show to other people that people with long-term health conditions can be active. So Geraldo's image, you can see his scar from his open heart surgery. We have people using walking aids, inhalers, different taking medication that they have on their day-to-day to support with the management of their long-term health condition. But then we also want to show that they can be active in realistic and attainable ways. So we don't want to show somebody who's living with a health condition completing a marathon, because whilst that's absolutely fantastic, it's not going to resonate to the people that we want to encourage to start being more active as well. So they're the sort of three key things, I guess, on that point for me.
Yeah, definitely. And we want to see real people who are like us doing those activities. And didn't you have an example of sort of how We're Undefeatable have done this in practice? I wondered if you could share that.
Yeah, absolutely. So we've launched a local campaign in Blackburn. I'll share a link so people can take a little look. And this is all about encouraging local real life stories of people getting moving with a health condition, which again, we know will relate more to the people in that area because they will see local spaces, people from a similar background who are being active in a way that works for them. And I guess what we've been able to do with the local campaign from that sort of accessibility and inclusivity point of view from a marketing is we've worked with local partners to provide British Sign Language to reach more people living with long-term health conditions who are living with impairments. We have produced some videos in enhanced audio to support those with visual impairments. We're creating easy read formats for people living with learning disabilities as well in the local community. The website that it's hosted on has a range of different languages, which covers all of the major languages in the local area. So we know that will provide then all of the content that we have in an easier to read format. And I should say, with all of this, the importance of local stakeholder engagement has been huge. For British Sign Language opportunity only came about when we met somebody who attended our launch event a couple of months ago. And from then it snowballed, and we then created these opportunities in collaboration with the local stakeholder. And I think that's the power of lots of this work, is that there'll be some great assets in local communities and wider who can really help to ensure that it's more inclusive, especially where you may not have the expertise to do that yourself.
Yeah, that's brilliant. And definitely people with lived experience as well. It is, like you say, bringing in those assets.
Yeah.
And Nicola, I wondered if you would like to bring in your perspective, particularly from Activity Alliance.
Of course, yeah. So I was, if you were watching my camera at the same time, I was nodding along to everything that you were saying there, like, yeah, exactly that. The especially the bit you just mentioned about kind of adding British Sign Language onto videos, we promote that as best practice where possible, because we know it's expensive. It can be expensive to add those extra things onto videos, but if you are able to budget that in from the beginning, it just makes it so much simpler. So yeah, for sure, those kind of top tips are really helpful. But yeah, we have a huge amount of insight around inclusive comms and what's helpful for disabled people. Especially on our website, we've got some resources as well that are really helpful that I'll come back to as we go through the session today. But I wanted to mention about what you're saying about people with different impairments as well, because disability as itself is complex, and no one is, just their one impairment. And actually, I think it's 75% of people have multiple impairments. So yes, you might be able to see, or you might be aware of one particular impairment or condition, but actually it's more likely to be a bit more complicated than what you might think. So yeah, do consider those when you're kind of planning events or putting on activities. Is that there's probably other things to think about that may be affecting people, and whether they can take part. And that probably leads me on to kind of what we class as disability as well, because there's no kind of stamp or anything, to be a disabled person. There's no official register that you become on with disability as a whole. So when we're talking about disability, we're talking about anything that's a kind of a long-lasting impairment or condition. So that does include your long-term health conditions. It does include mental health conditions, as well as the things that you might think are kind of more well thought of when you're considering disability. So yeah, we do work with you guys with Pete and his team at We're Undefeatable, with the Richmond Group, as well as loads of other partners within the sector when we're talking about disability, as well as the more traditional guys like British Blind Sport as well. So yeah, that's probably something to bear in mind when we're talking about disability and long-term health conditions today. Is it's a huge amount of people that we're considering. It's about 21% of people within the population, which is massive. But yeah, that's something else within the your report, Pete. Your report, you wrote it all, I'm sure. The Bridging the Gap report, that the people with long-term health conditions that you actually spoke to, 61% of those people would class themselves as being disabled, which was a huge number for me personally. I was expecting it to be a bit lower than that, but really does show the kind of crossover between who we're talking about, and actually we're talking about the same people of what we're doing, which is why kind of understanding that person-centered approach is so important. We also know that disabled people, whilst they might fall under kind of the umbrella of being disabled, sorry, my lighting's gone strange. I feel like I'm going into the abyss. No, we know that just there's about half of disabled people that would fall underneath the banner of being disabled may not class themselves as being disabled, or wouldn't necessarily say that they were disabled if they were putting themselves on a form or whatever it might be. For whatever reason, it might be that they're just not comfortable telling someone that they're disabled, or they just might not consider themselves to be disabled as well. So what you're saying about terminology and kind of the messaging and the tone is so important, because you've got to hit the right people who might not be necessarily kind of they might not listen to anything that's about disability or inclusion in
Yeah.
particular, but having that real inclusive approach is so important. We have developed with disabled people, we developed a resource. It's called our 10 principles, and they are fantastic principles, whether you're trying to engage disabled people or not, just to work by. So they're things like make sure the activities are local to me and represent me, things like that. It's just really simple ways of engaging with disabled people in particular. But don't tell my boss this, but if you take out the word disabled and put any other characteristic in there, they work too. But yeah, don't tell, I'm here to talk about disabled people. But yeah, they're a really great place to start. It's just kind of understanding the values of the people that you're working with, and yeah, making sure that person-centered approach is most important, because nobody is just the kind of the sum total of what you can see, whether you're in person or on a screen. Everyone's got layers to them. Everyone's got many things to consider, and yeah, you've really got to just make sure that you're understanding who is in front of you.
That's brilliant that sort of breaks it down, because I think it can seem quite overwhelming sometimes when you're thinking about all the different types of people to be accessible for, but ultimately when you are accessible for them, you're accessible to everyone, so it's within everyone's best interests
exactly
to do that.
And we know that disabled people are part of every demographic across society. We know that disabled people are more likely to be in some kind of demographic groups, but yeah, if you can be inclusive, it's the way forward.
Yeah, definitely. And that person-centered approach as well is so important. And I know, Frankie, that is like very personal to you, so I wondered if you wanted to add anything on that.
Yeah, definitely. I mean, it is like we've already touched on. Everybody is going to be very, very different. You never know who's going to come through your doors or who you're going to meet and things like that. So I think having that real sort of that proactive sort of attitude, if you like, rather than a reactive, there's just touching on what Pete and Nicola have just said, there's so many things that unfortunately is still happening where there might be a specific session you're advertising or something like that for disabled people, or to try and get things more inclusive, and yet that is the only piece of comms that is accessible, and then all the rest are just they haven't thought about those different formats and things like that. We need to be doing it for everybody, like you say, that everybody is very, very different, but if you're doing that from the very, very start, you're automatically being inclusive to all. You're not just having to just tailor your post or your sessions or whatever it is for disabled people, making them accessible, if you know what I mean. It needs to go across the board. But there's definitely a confidence piece, I think, around that person-centered approach, about having confidence to ask the person or the group or whoever it is what their sort of support needs are, what they're looking to get out of whatever it is you're providing. Are you thinking about them as individuals? They're going to give you all the answers you need to sort of take the weight off your shoulders if you're lacking in confidence a little bit about how to facilitate whatever it is your provision is, or what you're providing for that person or that group. It'll be much, much easier for you if you do have the confidence to ask those questions, because that will essentially make your life and that job a bit easier as well for you, when you know what you need to provide and what their sort of end goal is and what they're looking to get from you. I think it works both ways. The person with the impairment or the health condition may not be overly confident about meeting you and attending what it is you're providing. So that two-way sort of conversation, I think, really helps across the board, with provision and also for your participants as well. Really, really important that you find out as much as possible that you can about them, where appropriate, and the rest will obviously fall into place from there.
Definitely. And in terms of when, say, for example, it is a physical activity itself that people are going to, or it's a leisure centre that are trying to be more accessible. I know, for example, when you were at British Blind Sport, you did that training for staff, and that was really on that person-centred approach. So I wondered if you could talk a little bit more about that as sort of an example of practice of how you've sort of worked to create the confidence for staff to have that person-centred approach.
Yeah, I mean, the first thing I always did, they were very sort of informal sessions, very sort of discussion based, and it very much depended on who was in the room as well. I didn't always have the same sort of roles. I had different members of staff from marketing right to front of house to gym instructors to all sorts. I think it's really important to find out. The question I always asked them was, what do they think the barriers are for participants or their customers or whoever they were, but also what the barriers were for them. A lot of it that did come out was confidence, again, like terminology, like Pete's touched on, and things like that. And a lot of it was actually just that apprehension about approaching that person or asking those questions. So it was nice for me, having a bit of lived experience, to be able to break down some of those barriers about what is appropriate to ask, and what kind of things people are looking for in activity. But I think it's really good to have the discussion around it, and have that person there, or those people there, to be able to make it sort of quite informal. There's no robotic questions everybody needs to specifically ask, and it doesn't need to be a very, very formal approach. I think being open to the people or the group or whoever it is, like I said, that you're encountering. I think being open and being able to have to verbalize or to be able to communicate well is huge. Again, just to find out the needs and the wants of that person, to be able to break down those barriers by that sort of more informal approach. There's no formal, we can all provide kind of training and help and advice and resource about, how to approach different things and support different people with various different disabilities or conditions or whatever that might be. But, at the end of the day, everybody is very, very different. So being able to have that open conversation or that level of communication, however that might be, even if it's just over email or talking or whatever, whatever they need to be able to get the sort of mutual understanding across is really, really helpful. And I think also, bringing into consideration that not everything needs to be a huge challenge to be able to be inclusive for groups or those individuals. Sometimes the very, very, very small changes or adjustments, or again, a different level of communication that might just break down the barrier straight away.
Yeah, absolutely. It's not always things that are costly, is it? It's actually those like core interpersonal skills and feeling confident enough to ask what people want, because like you say, they know within themselves what it is that might make them feel more comfortable in a physical activity session. And actually it's okay to ask them and seem like you don't know, because if you haven't had lived experience, then why would you? And that's okay to admit that. And it sounds like as well, once, the marketing and all of those efforts to be more accessible have got people to that place where they are moving more. We know that what can be really helpful with motivating others to move more is actually using personal stories where people have managed to overcome their barriers. So Pete, I wondered if you could tell us a little bit about the storytelling campaign that We Are Undefeatable run.
Yeah, absolutely. I think I mentioned it earlier that everything that we do is through the real life stories of people with health conditions, and the reason is that connects, because somebody can connect on a range of different demographics and things that a person lives with, whether that's related to a health condition, a disability, or their background, where they're from. I think it's really important that we share real life stories, because then that helps to connect. And we know that our NHS and our healthcare professionals are some of the most trusted sources of advice around physical activity, which is fantastic. But we do know that then it makes it easier for them to signpost to a real life story, rather than them feeling like they're telling a person what to do, which again, we know creates a barrier then between the person with lived experience to then go and be active if they feel like they're being told or put onto something that necessarily might not be relatable for them. So yeah, I guess within the marketing approaches, we don't want to be tokenistic, but what we do want to do is really try and make sure that we're showcasing a range of different demographics, and in particular that showcase that particular area that you're working in. So for example, in Gosport, that might be very different to the demographic in Blackburn with Darwin that I've been working with recently. And it's really important to try and showcase those demographics within the work that you're doing, in able to make it a little bit more relatable to that local audience. So it could be different age groups, people from different ethnic backgrounds, showcasing a range of health conditions and also symptoms as well that we touched upon before, that people face, because you could live with 5-6 health conditions Or you could have 10 people all with different health conditions, but they might have the same symptom across them all, if that makes sense.
Yeah.
So actually, sometimes shining a light on a symptom could also be quite an interesting way to encourage people to be active. Again, through that imagery around showcasing that people are utilising walking aids, showcasing that people are utilising medication, that kind of stuff. We also think about multiple health conditions. So we know that a huge part of the population lives with more than one long-term health condition, and it's important to shine a light on the different aspects of those. Also, different areas of England or the UK or wherever you're working. Again, if we use Gosport, I have no idea about Gosport, by the way, but there'll be pockets of Gosport that have more affluence, for example, and then some areas with more deprivation. And it's important that we showcase both, so we're connecting with different audiences across that approach. And that's something that can be really important about being hyper-local in the way that you do your marketing. And I guess there's a bit of a broad brush way of doing that and looking at like local population health data and JSNAs and active life, stuff like that, which can give you the data about particular demographics. But back to Frankie, and I know Nicola would advocate for the same, it's also really important to engage the people within the community in designing the marketing that's going to connect with them, because we can create stuff that we think is going to resonate, or from maybe a national campaign we know has some success. But actually what works in Gosport and the people of Gosport might be very different to the next town or the next village or whatever that may be. So that's probably another thing for us, would be that sort of, yes, go and get all the data, public health data maybe, to help be hyper local, but then also try and engage with people where the opportunity arises to really get that lived experience understanding of the audience and what will connect with them.
Yeah, absolutely. And Frankie and Nicola, I'm not sure if you wanted to add anything onto that in terms of what you think is most meaningful when it comes to those storytelling campaigns.
Yeah, it's something that we advocate for as well, all the time. They're part of our 10 principles that I mentioned earlier. So principle number 6 is reassure me, which is a huge one, because it is overcoming that barrier of kind of the anxiety that, you know, I'm not going to fit in or I'm not going to be able to do it. And it is just that you know, we know that it's going to be welcoming and it's going to be suitable for the individual that's there. So yeah, that's principle number 6. And then the other one that I think is probably most important to point out here is principle number 10, which is show me. And that's where you can see people like yourself already taking part in the activity, just to be able to promote it to others, but also to go, yes, I do fit in this group, I am able to be part of it. The way that we like to kind of suggest that people do this kind of anxiety, fear kind of barrier, overcome that, is to even just put in little videos of sorry, the dog's now trying to join the pool.
Oh.
The people put in little videos of kind of walkthroughs of their sites, or sensory stories of, you know, this is where the car park is and this is going to be where you need to walk, and just really simple things that can be a massive thing for people, that it's just too much to kind of go to a new centre or a new location that they're not familiar with. So yeah, even just really simple things like that to pop on the website or to pop out on social media of, you know, this is what you're going to expect and this is who you're going to see at the kind of at the reception desk or at the front door, whatever it might be. Simple and easy things that, you know, they don't have to, you know, spend a load of money on, but can be really, really important to people.
Absolutely, and that leads really nicely onto our next panel, who will be discussing some of that. And also, I think it's really helpful for healthcare professionals who are trying to support people to be more active if they have those resources, because we do hear that a lot from social prescribers, for example, that they would love to have the time to be able to take someone to an activity. And we know that activity buddies can be a really good thing, but that can also be really hard to implement. And actually, for an activity provider or a leisure centre to give that information beforehand, you have no idea how many people that might impact and get them through the door.
If we're talking about leisure in particular, we have some training that's perfect for leisure centre staff, and it's for that front of house. So it's not for deliverers, it's not for people that are taking the activity themselves. We've got separate training for that as well, but we've got a piece of training specifically for people on the reception desk, people that work in the cafes, because they are just as important. The people that are serving teas and cakes, so important. But it's about that kind of welcoming and how, even just that confidence for people, because people are scared they're going to say the wrong thing and they're going to upset someone or offend. So yeah, we've got it's low cost as well, and bit of training on our brand new learning hub. If you haven't had a look, do check it out. But yeah, we've got a piece of training on there that is perfect for those members of staff, that your front door, as it were, your first point of interaction for people, because it's make or break. It can be absolutely make or break.
Absolutely. And it is that like principle of making every contact count, isn't it? And also I think when you think about sort of like a positivity bias, when people have had a good experience, they're really going to talk about that. And if they've had a bad experience, they're really going to talk about that. So it impacts the ripple effects as well of who they're talking to, their friends and family, who then might be encouraged or discouraged from joining that activity. So definitely it can be that one member of staff who could make all the difference to that community. So thank you. That's really good advice. And yeah, I wondered if sort of Frankie or Pete, you wanted to come in and build on that.
I was just going to quickly add, the thing that as well really enhances all of that is, we need to remember that this is very much a social thing. It's the exercise, the physical activity could be one very, very small part of that sort of whole day. So, that you might actually be accessing a facility to have a coffee, meet new people and things like that. I know personally, when I first lost my sight, I was fully sighted till about 9 years ago, and I got involved in visually impaired tennis, but I didn't actually pick a tennis racket up till about 3 sessions, away from when I actually met everybody. It was very much the social, and from that, I've learned various different things about accessibility and technology and getting the bus and public transport, and physical activity, although is very, very important, is actually might just be one very, very small element of that whole social thing. I know before I got involved in things like that, it was a big sort of difference for me when obviously I lost my sight, and I didn't know if I could get employment and things like that. So it does lead to, just touching on about that sort of front of house experience, that first experience. People will travel a long way to have that good experience and that welcoming environment. I mean, a tennis session that I attend and always have done is 2.5 hours away from me on a bus, and 3 buses. But it's the environment. It's the staff are brilliant. They've been really open and welcoming to us. They've trained their workforce, not officially, but they've learned from different things about having that visually impaired tennis group. And I think it's really important to realise that the social benefits as well, that come from get moving more or getting a bit more socially interactive with people, and that are massive.
Yeah, it's brilliant. And creating those opportunities for peer support. And definitely in the second panel, Hannah will be speaking a bit more about that, because that's exactly what she's done. And she's seen from that the ripple effects of how people do then get active, but they're empowered to do so by themselves because of that like safe environment that they've been in and the peer support that they've had. So it's a massive part of accessibility. And it's also quite nice to realise, because then it's not all on you. It's not all on that activity provider. Actually, everyone in that room has the capacity to support each other and have a positive experience. So I suppose it's just giving space and time for that to happen. And Pete, I didn't know if you wanted to jump in actually before I move on.
Just really quickly, just to agree with what both Nicola and Frankie have said, we've just been doing some work within the leisure sector, and sometimes in the networks that we work in, you're preaching to the converted a little bit, and we've been doing sessions with the workforce, and we did sessions with the GP referral team, which was fantastic and hopefully shared lots of great insights. But then their chief exec spoke to me at an event a couple of weeks later and was like, we should be doing this with our general managers. We should be doing this with our wider workforce that may not be as well connected to this. So I guess it would just be also with all of this, not just talk about inclusive marketing, inclusivity in general and accessibility. It's really important to try and bring everyone along the journey with you. And then, as you mentioned, it's that every contact then has an opportunity to have a positive impact on that person's experience or how it's perceived. And I think what we learned from the leisure sector is that it's about getting people, it might be about bringing people to your sessions or through the door, which is great and will help to increase activity levels, but also there's that dual benefit of then, if you have that inclusive marketing and comms and showcasing the way that you're supporting people through a person-centered way, then it also creates a really good feel for your brand and how people relate to your brand as something that they trust and that they rely on as a trusted, you know, physical activity opportunity. So it's that sort of dual purpose as well. But yeah, that was it for me.
No, that's brilliant. Thank you. And I suppose to just sort of wrap it up a little bit before we go into some questions, Frankie, I know we've discussed like different ways that people can be more accessible through person-centered approaches, but I wondered if you sort of had one key takeaway where it would be a good place for people to start with this.
I think we've probably mentioned it sort of already, but I think it's being proactive with things. You know, it's trying to sort of educate yourselves around, you know, the small sort of changes that can be made, or, you know, the good practices around communication and things like that, because it might not be the actual person themselves who's looking at your social media or reading the post or attending the centre that you work at or whatever. You know, a lot of things are word of mouth. So being proactive and being sort of, you know, open and inclusive for all, I think is really, really important. And that education piece, you know, that runs along in the background, just to like upskill yourself around the different things that can be made. You know, small changes and things like that will be massively helpful in the long run. And then you're not having to be sort of reactive on the spot on the day if you do get that some particular person, you know, wanting to access your services and things like that. You know, all that's going to do is delay things, you know, and sort of make you have to sort of react quite quickly to put things into practice. So I think really, you know, making the most of the resources that are out there and, you know, getting a look over them or a listen to, or however it is that you sort of access your resources, I think is really important as a whole, to be able to make the whole, you know, your whole organization, if you like, or your whole sort of outlook inclusive to start off with.
That's great, thank you. And in terms of sort of some takeaways, actions for people to do, Pete and Nicola, would you be able to share some of those things to do with sort of We're Undefeatable and Activity Alliance?
I'll let Nicola go.
Thanks. My kind of key takeaway would be just to try. There's no harm in getting it wrong. Just like if I was to get someone's name wrong when I met them, apologize and learn from it. And that's really what people want you to do, is to make sure that you are able to learn, but you're willing to try. So that's my key takeaway. But yeah, my kind of ask for everyone would be to check out our website as Activity Alliance. There's a huge amount of resources on there, whether that's our engagement, our inclusive comms and marketing fact sheets, which are kind of easily digestible, bite-sized pieces of kind of resource that talk about things like language and tone, as well as social media and videos. And it's all really nicely laid out, so you can find out what you want to know in a quick and easy way, as well as a whole host of other things, as like our new learning hub. So yeah, that's my ask, is just to spend 5 minutes to flick through our website and shout if you need any help, because that's what we're here for.
That's great, thank you. And Pete, what about We're Undefeatable?
Yeah, I would say I completely agree with the key takeaways of Nicola and Frankie. I think mine would be to try and understand the audience as best possible. Really try and engage with those with lived experience, and then design or create from there, whether that's finding out about that local data and what's important for your own local health care priorities, or really doing some focus groups to understand that audience. And yeah, from our point of view, I guess another takeaway would be we can encourage people to be active in any way. I think someone's put in the chat around sessions available locally, but there's so much we can do to encourage people to be active at home, and build activity into their daily lives through our messaging, through things like We're Undefeatable's resources that are all on our website as well. And we've created those to be, we call it condition agnostic, so it can be across lots of different health conditions. We're not saying here's a cardiac condition and this is what you need to do, here's this condition. It's actually, we create resources that have been brought together from all of our charity partners' expertise and had their review of it. So hopefully it has that sort of level of gravitas when it is around multiple conditions. But yeah, very similar to Nicola, really. Just go and visit the We're Undefeatable campaign hub. There's lots of resources and tools on there. whether that's to do with marketing and comms, or whether that's to do with resources that you can help to embed to support people to be active as well. So yeah, go and have a little explore, and very similar message. If you need any help, feel free to give us a shout.
Yeah, that's brilliant. Thank you. So we've got just over 10 minutes for questions, which is great. So I'll give you some time to have a think, and I'm more than happy for you to take your mic off or put into the chat. Oh, I think Sophie's just responding to you actually there, Pete, about those resources on how to be active with each health condition. And can you let us know when these might be available, please?
Yes, so we've just actually on our new website, and this is a really good example, and thank you for mentioning it, was a great way to show how we engage with the target audience to understand how to develop our website. And we did user testing with people living with long-term health conditions, and they said they did want some more condition-specific information and advice. So on our main website, I'll pop the link in the chat now. If you click on there, and then on the top bar, there is a drop down for your health condition. And then we've created health condition specific pages, which say a little bit about the benefits of moving more with that health condition, but then also has links through to either some of our own resources that could be useful, or some of our charity partner resources as well, because we've got 15 charity partners, and many of them have their own physical activity resources specific to their charity or whatever that may be. So yeah, that would be a really good place to start for that more condition specific information and advice.
Brilliant. And that's actually a really good point about the user testing, and actually just like piloting and seeing how whatever you're doing resonates with the target audience. Definitely don't underestimate that, because I'm sure a lot came out of that actually, that probably then led to the evolution of that new website.
Yeah, even really functional stuff like PDFs wouldn't open, which we would never have known unless you go through it yourself. So, you know, it was great that the organization that hosted it, and we could view the people going through the user journey, and there was something that didn't quite make sense, and we just wanted to simplify it, make it a little bit more tailored, but also taking on board the needs and priorities of the audience as well. So yeah, I couldn't recommend that enough if you are going through something similar yourselves in terms of redesigning a website or whatever that may be.
Yeah, and it definitely makes then the audience more engaged to use it, because I know I was part of the pilot testing for the campaign hub, so for like professionals to use, and it's actually just really nice to see that my feedback was taken on board, and then yeah, I'm more on board with it even so. Good
news. Good news. I'm glad we responded to that, Amy.
Yeah. Okay, someone here is saying that travel is a major issue. So I wondered if anyone would like to speak to that. I know, Pete, you've already said that we know at home is great, and we encourage people to move more. But if people do want to get somewhere, of course, that is a big barrier sometimes.
I'm happy to come in again on that. Yeah, I would say, you know, it depends on preferences, and people may want to go to a local community activity. So again, it's understanding what that person wants and needs, and trying to find ways to work on that. And I guess if there isn't the travel arrangement, or there isn't the infrastructure in place, then it might not be a quick fix, but there might be things that the collective we can do as a system, a local system, to influence decision makers to make things more accessible. And that takes time. It takes a lot of effort and a lot of knocking on doors, but that could be something that can be utilized. I know people have put on things through funding, or even sort of small pots of funding around transport and getting people to and from spaces and venues. But if it is stuff that's at home, then there's lots of resources out there, and not just our own resources, things on like follow along videos, workouts and routines that you can follow online, or even print off and utilize at home. So I would say there's a mix of both approaches. I guess trying to change the infrastructure is a little bit of a longer one, but I wouldn't discourage from getting on that journey with others to support that.
Yeah, Definitely. And in terms of sort of the confidence, Jane, in doing the exercises at home, I think one of the main things is actually just starting small. So it is really achievable. And that's part of those We Are Undefeatable resources, is they are very simple. It is 5 and 5, isn't it? So if you choose 5 exercises and you do it in 5 minutes. And people could do that for 30 minutes if they wanted to, or they can celebrate the 5 minutes they've done. But actually, to get people confident, it is meeting them where they're at and starting small. Steve, I believe you had your hand up first, so go for it.
Yeah, thanks. I'll just make a quick point on the last thing, because travel is a really important thing for getting to the place. But I think you also need to think about the journey that somebody's been on, because the travel itself could be really simple, but the journey could be incredibly difficult. And this relates to what I posted around, which is anxiety and mental health that disabled people have around not only their quote impairment, but also around life experiences. And for some people, a 10-minute bus journey is an absolute nightmare. And that person, when they arrive at you, will be in a really, really bad place. If you just think, oh, you'll just come down the road, let's go in and do some activity and stuff. So I just wanted to make that point, that the journey is different to the travel. And I think the last point, because I heard the use of the word impairment quite a lot, is that, so I've got ADHD, I'm disabled, and my executive functioning is lousy. If anyone ever told me I had an impairment, we would have a very, very long conversation about from that. So it's the social model of disability. It's about what we do to disabled people and to people with long-term health conditions, and really embracing that sort of language to me is super important, particularly obviously with the activity focus and the places focus that we've got today. So I just kind of wanted to push those ideas. I'm really interested in thoughts from the panel about that. Thank you.
Yeah, would anyone like to come in on that?
Yeah, I don't mind kicking off. Yeah, so I 100% agree with you, Steve. The social model is for sure the way forward for us. We preach it ourselves, and we do provide a little bit of training on it for people as well, or signpost people to further reading. I think that might be actually another key takeaway for people for this, because it is a huge part of understanding the barriers that disabled people face on a day-to-day basis. So yeah, that for me would be another piece to for sure have a look at, is the social model of disability. And I know that Sense have actually got a really good piece on their website which explains it in good plain English, because that is something else that we're not very good at as a society, is putting things in plain English for people to understand. And yeah, I completely agree. Please do have a look at that if you can.
That's brilliant, thank you. And Frankie, I know that you refer to yourself as with a visual impairment, and that's your own preference too. So did you want to add anything on that?
Yeah, I mean, there's a lot of different, there's a lot of different terminology out there, isn't there? And I would consider myself to have a visual impairment, but that's not, the case for other sort of disabilities or health conditions. So yeah, again, it's just that education piece, isn't it, around terminology and things like that. It does seem to change a lot as well. Once you get used to saying one thing, there's something else comes out.
Yeah.
It's a bit of a minefield, isn't it, when it comes to different things like that. But yeah, it's just that, again, that little education piece around how you are sort of promoting yourselves and the language that you are using. But just to touch on that travel bit as well, totally agree. It's not always the ease of the travel. It's actually what it sort of entails and things like that. But I think obviously, when we were talking about the social element of things as well, hopefully when you are going to an inclusive centre or session or whatever it is that you're going to, if it is a bit of a nightmare to get to, or the experience isn't great, hopefully that social element will come through. You might be able to meet other people, which might encourage you just to do sort of walks with that person, or so there's the social element as well, that will hopefully, you might not have to go there every single week, but you might have actually met people there that you can also encourage to do things sort of on a more local level, or something that's a bit easier for that group or those people to actually